Hello. Well, I'm really pleased today to be joined by Sarah London, who's president of Healthcare Enterprises and an executive vice president of Advanced Technologies here at Centene. Sarah, you've been with us, what?
6 months.
God, it seems a lot longer with what you're getting done. Time goes by quickly. Let's talk about Healthcare Enterprise. How do you plan to take it forward?
Healthcare Enterprises is, I think, one of the more exciting parts of Centene, maybe just because I get to work on it. But it represents, I think, a number, as you know, right, a number of very interesting companies that are doing innovative work that are important to our health plans, but also serve third-party customers. And so finding the right structure that allows them to do both of those things and still flourish and to keep the entrepreneurs and the innovators that are in those companies engaged, even though they're part of a Fortune 50 company, is a challenge. And I think one that we've started to see some real success with. With the introduction of Magellan into that mix, I think it's allowed us to start to organize a little bit differently and start to identify some real key themes that we're going to go after in healthcare enterprises. So continuing with advanced technology and innovation, Apixio obviously is a part of that. Thinking about behavioral and specialty health, bringing our pharmacy assets together, and then starting to think about a real focused provider strategy and how that may help in different geographies enable further what we're trying to do supporting our health plan members.
I think it's so important. I mean, I've watched large companies bring on these entrepreneurial, really great companies and crush them. And so I think what you're doing is really helpful to avoid that. Where do you see us taking this in the future? How do you see this continuing to develop?
I think technology will allow us to become incredibly efficient at what we do. And we've got a number of systems, lots of different companies that we've acquired. So getting to a place where we have a consolidated systems view and where we are as automated as we can be about paying claims, that we are as efficient as we can be about prior auth, that we just run a really, really tight operation. I think it's not as sexy, but it's incredibly important. And then, from there, I think about the fact that if you have that, you can actually start to build the digital bridges out to your membership in a fundamentally different way. And you can understand your members better, and you can sort of deliver what they need to them to help members make better decisions in their care journey. And that's really, what I think our role is at some level is helping to share the risk that a member lives with every day in terms of managing their own health and doing everything we can to help them make better decisions, to partner better with their physicians, right, and to drive better outcomes. And so I really I've always seen this moment in time as sort of us at a precipice, not dissimilar to where financial services was in the late 80s and early 90s. So you can get to a place where the systems start to get automated enough that you can close the gap between the administration and those customers and those members and really create the delightful experience we keep talking about.
That's great. We've made a lot of progress in a short period of time. As I've said many times, I get to talk about it, and you all get to do it.
Well, it's a great gig.
Thank you. Thank you.
Thank you.